Good afternoon, everyone. My name is Shannon Chen. Today, I will be presenting a comprehensive review on generative artificial intelligence in drug discovery. My presentation is primarily based on the 2024 review paper by Gunwell, published in Frontier in Pharmacology. We will walk through the basic framework of this algorithm, their recent clinical advance, and the critical challenge we face today. Let's start with why. Why do we need generative AI? The pharmaceutical industry is currently facing a crisis known as the Iran's law, which is reverse of the Moore's law. Despite massive technology advance, the cost of developing a new drug double roughly every 9 years, now exceed $2.5 billion per drug. Furthermore, we have to search space problem. The estimated number of the drug-like molecule is 10 to the power 60. Traditional high-throughput screening can only cover a tiny fraction of this, only about 10 to the power 9. Essentially, we have been trying to find a needle in the haystack by blindly picking through the straw. We need a new approach. Instead of finding a needle, we need to build a needle. This brings us to the fundamental paradigm shift. Historically, we use discriminative AI like QSR model. Let's act as filter. You give a molecule and its predict property like toxicity or log-P. But crucially, it cannot find a new molecule outside of your existing libraries. We are now shifting to the generative AI. This is inverse design. We start with a desired property, say a specific binding affinity, and ask the AI to generate a new structure of the match it. As illustrated in Figure 2 of the review paper, this process relies on the two key engines. The first one is transfer learning, where the model learns chemical grammar from the massive general database. The second is a reinforcement learning, which optimizes the molecule of the specific target. So, how does this actually work? Based on the Figure 1 of the paper, the workflow is straightforward but rigorous. We input data into the generative AI, which creates a new output, image, text, or in our case, new molecule. However, generative generation is not enough. The output must be evaluated for novelty, validity, and usability. Let's look at the first major architecture, variational autoencoder, or we call VAE. As shown in Figure 3, variational autoencoder work by compressing discrete molecular structure into continuous latent space. Think of this latent space as a map of chemistry. By moving slightly into the space, we can smoothly involve a molecular structure. The encoder compresses the data and the decoder reconstructs it. The key advantage here is optimization. We can mathematically navigate this space to find the beta molecule. Next, we have the gain and the reinforcement learning. The Figure 4 on the top shows the gain structure. It is a game between the generator, which creates a fake molecule, and a discriminator, which tries to spot the fake. This forces the generator to become incredibly realistic. However, the realistic does not mean effective. There is where reinforcement learning comes in, shown in the Figure 8 on the bottom. Here an agent modifies a molecule, like adding a methyl group. and receive a reward if the bioactivity improves. This is actually how in silicon medicine discovered layer DDR1 inhibitor in just 25 days. The most recent breakthrough involves transformer, similar to the technology behind ChatGPT. As visualized in Fig 9, we treat chemistry as a language. If we reason a model as a text string, the AI can predict the next token or the next item to complete a validated structure. The attention mechanism allows a model to understand a long-range dependency, like how an atom on one side of a large ring affects an atom on the other side. Of course, how we represent data matters. On the left, we have the SMILS string, while efficiency for the transformer, they are fragile. One wrong character breaks the molecule. On the right, as shown in the Figure 5, we have a molecular graph. This is more natural representation, using node for atom and edge for the bond. Using the graph natural network allow us to avoid syntax error and model the topology directly. Theory is good, but does it work clinically? Based on the table 2 from the review paper, the answer is yes. We saw the first AI discovery molecule enter phase 1 in 2020, and by 2022, the pipeline expanded rapidly. Now in 2025, we have seen validation with a positive phase 2 results. However, we have also seen failure, which help the industry matter. Let's look at the biggest successful story in silicon medicine. They utilize an end-to-end platform called Pharma AI. Their lead assets, ISM001 to 055, targets is idiopathic pulmonary fibrosis. What makes this unique is that AI discover a novel target. In this case is TNIK, and design a novel molecule. The reasons from phase 2A data show significant improvements in lung function. This validates that generative AI can go all the way from the target hypothesis to human efficacy. Taking a different approach is a recursion. Instead of just generating structure, they use computer vision. They analyze millions of the cellular images to see how drug can change cell morphology. According to the review data, their assets REC-2282 is now in the phase 2 trial for NF2 mutated meningioma. This proves that combining the generative AI with the high context image is a powerful tool. However, science is born on failure. Excertia DSP1181 was the first AI drug to enter the trial, but it was terminated in phase 1. The benevolent AI BN2293 for the methods failed to show efficacy in phase 2. The lesson: AI solved the chemistry, make a molecule that is the target, but it did not solve the biology. Choosing the right target. Speed is not enough. We need better biological hypotheses. Moving to the current challenge, the first is the semi-ability. Generative models often hallucinate. They create a perfect molecule that cannot actually be made in a lab. To fix that, we we are now using a solution like reward shaping, where we penalize complex sentences in the loss function. We're also using a tool like Senate, which generates the recipe for the molecule, not just for the structure, ensure 100% generalizability. The second challenge is the data scarcity. Unlike ChatGPT, which trained on the whole internet's high-quality drug data, is extensive and scarce. To mitigate this, as mentioned in the framework section, we rely heavily on the transfer learning, pre-trained on the general chemistry before fine-tune on our specific target. Looking to the future, AlphaFold 3 represents a massive leap. Released just recently, its move behind protein. It can predict a joint structure for the protein, DNA, RNA, and the small molecular ligand target. Thus enable blind docking. Design a drug without even knowing where the binding pocket is. It shifts the field from the simple structure prediction to the interaction prediction. Finally, the ultimate frontier is the self-driving laboratory. We are closing the DMA loop: design, make, test, analyze. Robotic platform can analyze the AI design and test them overnight. Let's data feedback into the model, creating an active learning loop. Let's move the AI from the passive designer to an active scientist. In conclusion, first, technology maturity. Generative AI models have proven they can accelerate the design phase and produce high-quality candidates. The second, the bottleneck. The challenge has shifted downstream. We can make molecular fast, but we need to ensure they hit the right biological targets to survive phase 2. The third, future outlook. The coverage of the structured AI like AlphaFold 3, phenomic and automatic offer our best path to the final breaking Eroom's law. And thanks attention.